we are our mother's voice, and I'm glad that you're letting us tell mom's side of the story.
Even when Kathy Stiltner's body started to betray her in 2022 due to chronic diabetes and painful osteomyelitis, which is an infection of the bone, her daughters held out hope she would regain her mobility and agreed that a skilled rehab facility would help her achieve that goal.
Once they, fixed the MRSA, they wanted her to go to Westport for a skilled rehab to be able to use her hands and her legs.
Kathy entered Westport Rehabilitation and Nursing Center in Henrico on November 30th of that year. Medical records show that facility staff noted she had a stage 2 pressure ulcer on her sacrum upon admission. Kathy was then diagnosed with COVID, so her daughters were not allowed to see her for 10 days. When she finally got inside to see her mom, Caitlin Cothran says she was taken aback.
She was so dehydrated, very delusional. She wasn't recognizable. Her face had drawn in, her lips were crusted over.
After just 20 days there, the daughters insisted their mom be removed by ambulance from Westport and taken to the hospital. That is where doctors found she had acute metabolic encephalopathy in the setting of a UTI, and the ulcer had worsened to a stage 4. The wound can be seen here in this picture, which we opted to blur because it was extremely graphic. Staff at VCU had to debride the wound and attempted surgery to divert waste away from that area through an ostomy. Kathy told a chaplain at the hospital that she had previous bad experiences with rehab, and the chaplain described Kathy as tearful and scared about her upcoming transfer out of the hospital to a nursing home. According to Kathy's medical records, Kathy had an attending physician at the facility, the same doctor who is listed in license renewal application documents for Westport in 2023 as the medical director there.
When you see that name, what comes to mind?
I don't know who
I don't know who that is.
We could not find anything in the medical records from her time at Westport provided to us by a former lawyer for the family that showed that doctor ever laid eyes on Kathy. The lawyer told CBS 6 that he could not 100% confirm that doctor's records would be included with the ones that he received, but he is almost sure they would be if they existed. We did find a record that showed a psychiatric doctor visited her. Kathy remained at VCU for a couple of months until she was transferred to Colonial Heights Rehabilitation and Nursing Center in February of 2023. Prosecutors have charged multiple staff members at that facility in connection with the death of a patient and alleged elder abuse. In addition, the medical director at Colonial Heights was charged with abuse of a vulnerable adult for what prosecutors call a, quote, lack of oversight of patient care in a separate case. Neither of those criminal cases involve Kathy. Now, according to VDH and the State Attorney General's office, Colonial Heights and Westport are owned by the same company, Medical Facilities of America, or MFA. 1 month after her mom's transfer to Colonial Heights, her daughter Brittany says she made a disturbing discovery after arriving to feed her breakfast.
When I walked in, my mother was hanging off of the bed with her arms in the air. I called EMS. EMS arrived. My mother's sugar dropped to 53, and they transported her to Southside.
After the hospital visit, Kathy went back to Colonial Heights. Her daughters ultimately pulled her out on May 9th of that year. She died a few weeks later at the age of 61. Among the causes of death on her death certificate, the stage 4 sacral ulcer. The experience left the daughters wondering what exactly is the role of the medical director and attending physicians at these nursing facilities.
Those patients are your responsibility.
That's somebody's mom and dad.
Hey, Dr. Wright here. I just wanted to check up on you again.
Dr. Jim Wright says he takes that message to heart.
Deep breaths.
He has worked in various facilities across Virginia for 25 years, including the Lakewood Retirement Home in Henrico, where he is the current medical director.
We are in an advisory role to the nursing staff, the director of nursing, the administrator, to make sure that appropriate medical care is being given to patients.
Dr. Wright even started his own geriatric specialist group aimed at ensuring patients in long-term care and skilled rehabilitation facilities see their doctors as much as they should be.
Certainly when someone is first coming in, physician involvement, certainly for their history and physical, which should occur within the first few days, and then ongoing visits by the physician for at least 2 or 3 weeks, and I would say on a weekly basis, is super important to the success of their rehab stay.
But state and federal laws do not require that, nor does the law require that a facility's medical director do the examination. Instead, they mandate that a physician do an initial comprehensive visit on a patient when they move from a hospital to the rehab facility, but they actually have 30 days to do it.
Even though nurse practitioners are very capable of addressing the majority of any issues that happen to our skilled rehab patients, the physician, with their better training, their scientific grounding, are extremely vital in those first few days to make sure that the care is appropriate, the medications are appropriate for each patient.
After that, doctors have to see their skilled rehab patients every 30 days for a recertification visit, but every other one of those can be delegated to a nurse practitioner. Dr. Wright says physicians should really be checking in with their rehab patients much more frequently, especially because in the past 25 years, Medicare revisions mean acutely ill patients are getting discharged from the hospital into rehabs much quicker.
And you don't necessarily think some of these facilities have caught up to that change?
I have seen that to be the case, yes. So a lot of us are still practicing 1990s medicine, where physicians could come by the nursing home once a week or once a month and treat their long-term care patients. That is not the case now, and I think some physicians have not caught up to that.
By law, nursing homes and rehabilitation centers have to employ a medical director to oversee care, but that doctor does not have to actually visit with patients.
The medical director would be monitoring all the care of the patients, and really how it works is that they would be alerted if there's any deficiencies in care, and they would contact the physician, the nurse practitioner, and make sure that they understand standards of care and bring them up to those standards of care if they need that.
There is also no cap on the number of facilities a doctor can be the medical director for. We found one doctor, the same one who was Kathy's attending physician at Westport, is the medical director for 31 nursing homes across Virginia. That's according to VDH. For comparison, the medical director at Colonial Heights is the medical director at 3 facilities in Virginia. VDH says there is no limit to the number of patients the medical director can have if they have sufficient extenders, like nurse practitioners, to meet the requirements of the facility. We also found that some of the attending physicians for skilled rehabs and nursing homes in our area have other doctor jobs as well.
Is that common that these doctors would have second jobs? This is just kind of a side thing?
I think that is common in other groups, yes. And I've found personally and professionally in my life, I'm unable to really manage more than 2 skilled nursing facilities. It's impossible. It's impossible for me to be there and to treat patients appropriately in more than 2 skilled rehab facilities.
Medical records do show a physician at Colonial Heights visited Kathy once or twice a week while she was there, but even that, her family argues, is not enough.
I do feel like if I would have brought her home sooner and didn't listen to what she said, then maybe I could have saved her.
We reached out to a spokesperson for Colonial Heights and Westport to share Kathy Stiltner's daughter's concerns. The publicist, Mindy Barnett, told me that she had no comment due to HIPAA sensitivity. We also reached out to Kathy's doctor while she was at Westport. A lawyer actually responded and said it was clear any information we received was incomplete or inaccurate. But when we asked for medical records that could show the doctor visited Kathy, the lawyer said they were unable to provide any such information due to legal and privacy restrictions. As for that doctor's medical director role at 31 different facilities, the lawyer said, quote, "We are not familiar with the specifics of the information you claim to have received from VDH, and as such, we will not be addressing these questions." I'm Melissa Hipolit for CBS 6.